Palliative Care offers specialized medical treatment for patients and their families dealing with serious illnesses. Patty Voss is here to discuss palliative treatment and its benefits for patients.
All right, welcome to Your Health with Terrebonne General Medical Center. I'm Martin Foss, and as you heard in the intro, Patty Voss is our guest tonight. There she is. She is a TGMC staff nurse. And Patty, welcome aboard. We appreciate you being here.
Thank you very much, Martin, for having me.
All right, palliative care. First of all, to explain to the audience, what is it?
Okay. Palliative care is a specialized medical care for people with serious illnesses. The main focus is to provide patients with relief from the symptoms of pain and stress of whatever serious illness they may have. It's basically a comprehensive management of the physical, the emotional, cultural, and spiritual needs of the patient and the family that are dealing with this very advanced stage of illness.
And I know we have some graphics that we're going to put on the screen for the viewers to look at, and there are certain types of serious illnesses, and I guess which types might palliative care patients have, and we'll show that to the audience.
And everybody's familiar, with cancer patients, but it's other disease processes as well. As they can see, the cardiac diseases such as congestive heart failure, chronic obstructive pulmonary disease, which is known as COPD, kidney failure, Alzheimer's, goes dementia, ALS. It just goes on and on and on.
Okay. Now, what symptoms may seriously ill patients be suffering from that palliative care could be used for?
The most common is pain. Okay. And that is going to be probably the most addressed issue that we will have. But it also can be shortness of breath, fatigue, it can be nausea, vomiting, loss of appetite, difficulty sleeping, and really even a spiritual guidance sometimes is needed with these patients.
And I saw you also have emotional symptoms too.
And a great deal of stress comes with dealing with a serious illness, both for the patient and also for the family. And we work to provide the best quality of life for both the patient and the family. And we have to take into account the emotional, the spiritual, and the physical needs. And those are three very important parts of the palliative care, comfort care program.
How does the treatment work, Patty? And also, are there doctors that specialize in palliative care?
We do have various specialists and doctors that can provide this type of treatment. An example of pain could be someone from the anesthesiology department. It's a combination of doctors, nurses. It's a team effect. We work together with the primary care physician, and we want to provide the best treatment and the best option for treatments for these patients.
Okay, now what do the specialists do? When they get a patient of this magnitude, how do they treat?
What we do, first of all, we work like on a consulting type basis or referral basis, and it's either from the patient or the family, but it's the primary care physician who initiates it. And we work as a team. We go in and we speak with the patient, we speak with the family. We don't put a time limit. It's not like the doctors making rounds where they just go in for a few minutes a day. We'll spend whatever time is necessary to try to learn, to see what their needs are, and to help guide them in this. It's a group effort. It's a team effort. And then we're going to be guiding them every step of the way once we see what their treatment plan is going to be. And, dealing with serious illness, it's always a very confusing and a very stressful time to everybody that's involved. And our role and our goal is to help make sense of this illness and to offer the support in all the areas of treatment that are necessary.
I guess then we get into the philosophy of palliative care, and you sort of touched on that, but go a little more in depth. What is the philosophy behind it?
The philosophy basically is to promote dignity and the quality of life that meets the needs, and you'll hear me say this again, the body, the mind, and the spirit. We aim to advocate and support the patients and their families' informed decisions. We want to ensure that their wishes and their values of the patient and the family are identified and very much respected. We do this by, it's a trinity of palliative care, and basically the trinity has three main aspects. It's communication, it's education, and it's negotiation. We aim to communicate very clearly with the patients and the family members. We want to educate the patient and the families on the available treatment options that are available to them. And we want to assist them in this transition of the patients to achieve the best quality of life possible. And I hate to refer to it this way, but the Trinity is the meat and the potatoes of this care. Right. And I think people could identify with that.
Okay, let's hold that thought. We're going to talk about if palliative care replaces medical care when we come back. But right now, we'll take a break and hear from Terrebonne General Medical Center.
Terrebonne General and Mary Bird Perkins Cancer Center bring a new standard of high-quality, comprehensive cancer treatment to our community. Now in one convenient location in Houma, bringing together world-class technology and a caring and healing environment to provide the best patient experience possible. Our new cancer center was built for you because we care for you. Mary Bird Perkins Cancer Center at TGMC, Houma.
All right, welcome back. My guest tonight is Patty Voss with Terrebonne General Medical Center. She's a staff nurse, but we're talking about palliative care, and we've been going into detail. She's done a great job of educating us, but I guess the next line of questioning, can palliative care replace medical care?
What palliative care does, Martin, it works in conjunction with the medical care. The primary doctor is part of our palliative team, and we all work together in providing this best, well-rounded treatment. So it's an adjunct to the medical treatment. That is all.
Now let me add, outside of the hospital, or the medical center, I should say, is this treatment available?
The treatment can be available. At this point in time, what we're doing is we're offering it to the patients that are in the hospital patients. But there are areas in Louisiana that do have palliative areas or care teams that do work out of a hospital setting. You may have somebody going to physical therapy, for instance. They may be receiving chemo, like say at Mary Bird Perkins or something like that. But it is offered out of the hospital. Our program will be for in-house patients at Terrebonne General. The
more I listen to you, Patty, the more it almost sounds like hospice care. Is palliative care the same as hospice care?
No.
Okay, a little different?
Hospice care, it's a little different. They do work hand in hand.
Okay.
They can work hand in hand. Hospice care is for terminally ill patients who are no longer seeking curative or aggressive treatments, where palliative care, patients are still receiving treatment or medical advice or this type of thing. Basically, palliative care is not hospice, but hospice is palliative care, and we could do a whole nother segment.
That's a good explanation, though. I'm glad you told me that. Who's eligible for palliative care?
Palliative care is for any patient with any serious illness, life-threatening at any stage. It doesn't matter what the diagnosis is. Any patients dealing with intractable pain. Earlier I had said about anesthesia maybe being involved. Sometimes it's just having to block patients for pain control. It's also available for families in need of support to help understand what's going on with their family member.
And how do patients go about receiving this care, and who could they call?
Basically, for us, as far as Terrebonne General is concerned, the doctor, they can talk to their family physician, their primary care provider. He'll make a referral to us. Once that is done, we will see them on a very timely basis, and we'll always be in contact with that physician. Once again, it is going to be available to in-house patients at Terrebonne General, and they'll be able to contact us by calling the hospital at 985-873-4141, or they can go to the website at tgmc.com.
Patty, thank you so much for joining us. A good explanation. You got me straight now, for sure. So good luck with the program.
All right. Thank you very much, Martin, for having me.
Anytime. And we'll take a break. When we come back, more on Bayou Time. Don't go away.
Take it easy.